Hello, it is a pleasure for me to present you our conference using virtual reality in the treatment of social anxiety disorder technological proposal. This work was made by the team formed by Carlos Ramos, Pamela Costa, Jaime Moscoso, Omar Condor, and Jorge Cruz. We are an Ecuadorian team from some universities, Pontificia Universidad Católica, Universidad Indoamérica, and Universidad Internacional SEC. Social anxiety disorder, as every other anxiety disorders, refers to fear, distress, and trying to avoid a determined stimulus. When a person presents social anxiety disorder, she feels that is being the target of negative judgment and loss from the social interaction. And it will be happen in many different contexts. For example, in the scholar environment, when there is the need to be in front of other students even when is eating or drinking in front of others. So this explains why people presenting this disorder avoid any social event or any place where they could feel they are not safe. People with this disorder worries for being judged by the others as an anxious person, weak, mental ill, dirty, or disgusting, not forgetting the physical changes they could present, such as facial redness, trembling, stumbling, sweating, paused speech. These behaviors and thoughts make a person life to be impaired. Because of it, they'll tend to avoid even simple daily life activities. For example, buying something in the supermarket or asking for an address at the school. It is possible to see that this student missed the day, was supposed to talk in front of the rest of the classroom, or when there is teamwork that needs to be done because they rather avoid this situation. One of the most important characteristics of people presenting this disorder is that they recognize the fear to be surrounded by people as excessive and irrational. Although the principal reason that stops them from asking help is the feelings of being embarrassed, preferring like this, to avoid every social contact and deciding to isolate themselves, which at the same time would trigger other disorders related to depression and stress. Systematic desensitization. Systematic desensitization is a behavioral cognitive technique that helps in the treatment of anxiety and avoidant behaviors that appear and answer to stimuli that will generate distress in a person. In the execution of this kind of treatment, the person must receive training based on the control of anxiety physiological reactions that will show when facing a determined stimulus. The success of this process is based on the autogenous or progressive relaxation, which activates at the moment when the person presents an anxious response facing a stimulus. In this treatment, the individual is exposed in a successively way to the stimulus that generates a negative answers. For example, in the social anxiety disorder, the person suffering it could show him or herself distress when talking in front of others. In this scenario, besides the therapist define the subjective units of distress that creates the situation defining a baseline of working and as relationship is incorporated. The individual must get closer to the distressing element, this diminishing the USUDs, hence and facing its anxiety disorder. Treatment proposal through virtual reality. As it was described above, a person who receives the psychological treatment based on the systematical desensitization will be exposed successively to the stimulus that triggers the negative response. It is important to address that this exposure could represent a risk to the person experiencing it. because of the physical responses that would appear, and if something unexpected arises, it could bring negative consequences for the person exposed. Hence, interventions for anxiety based on virtual reality keeps the person exposed safe and away from the exposure risk. In this picture, you can see the technological proposal of treatment for social anxiety disorder with virtual reality. Therefore, our treatment proposal will be based on a technological application that will keep the scenario of exposure safe for the person who is receiving the treatment for anxiety disorder. This represents a significant contribution for the present psychological treatments. In the case of social anxiety, the individual who is being treated will not present the same amount of distress when talking in front of people, decreasing like this the negative impact that not being in treatment will bring in the familiar, social, individual, and any other context where the person develops. For example, presenting low self-esteem, shame, or trouble when making teamwork. In this sense, the application to develop must have following elements: a controlled environment where the person will be to receive his treatment for social anxiety disorder, interaction with the application through a virtual reality helmet, physiological response markers that will allow monitoring her beating rate, respiratory frequency, motor, thermal, and any other responses that will arise when a person suffers social anxiety disorder is exposed to a distressing stimulus. What is the previous research of virtual reality used for anxiety disorder? Previous research has described the benefits of the intervention through virtual reality to treat anxiety disorder. For example, in this table, we can see a revision of studies that have approached this thematic and will be used to build up our technological application of interest in this work. What are the conclusions? Psychological treatment for social anxiety disorder is a clinical procedure that still is in development. One of the most interesting proposals to approach is the systematic desensitization therapy. It consists in the successive exposure of the patient to the distressing stimulus. Throughout the process relaxation, it is found that this decreasing of the negative physiological responses. It's important to mention that this procedure gives important advances to the patient, although it is not secure at all when it comes to control the variables that could generate any risk for the patient, because if something unexpected appears, will be risk and could bring some negative outcomes in the person's life. As a contribution to this research line from the usage of the technology, it is proposed to develop an application that allows to control and overcome the risk that the patient will face when being treated. Hence, in this work, it is proposed the usage of an application of virtual reality where it would be possible to apply the systematic desensitization in patients presenting social anxiety disorder while being exposed to the trigger stimulus. The content of the technological development proposed sustains that there must be a controlled environment and with contextual validity for the individual presenting social anxiety disorder. The interaction with the application must be with the usage of a virtual reality helmet with physiological markers of response, scores for feedback for the patient and the clinician. Also, it must contain different levels of exposure to social interaction, allowing the person to improve the condition of their social phobia. The next step in this research that will be realized in this research is the technological prototype design and its application through a quasi-experimental study in people that present social anxiety disorder. Thank you so much for watching our conference.